So Mr. White, you're good to go.
All right. Make a motion to accept the agenda for the Scituate Board of Health Wednesday, October 13th, 2021 at 6 p.m.
So moved.
Okay.
You have to do a
Karen, how
roll
do
call
you vote?
vote.
Do we have to second? How do we second when there's just two of us?
Doug can second,
Second.
then he'll call a roll call vote.
Okay.
Okay.
Roll call vote. Karen?
Yes.
Doug, yes. And Kelly is absent.
Okay, so that's good.
Okay, so schedule items. First one, discuss and vote Scituate private well regulations variance request for 100 Stockbridge Road. Not sure if anyone's on 400 Stockbridge Road.
Yes, I am.
Okay, just need you to state name and address.
Yes, this is Mark Palat with Dakota Partners, 235 Bear Hill Road, Waltham.
Okay, welcome.
Hey, thank you, thank you. Basically, we're here for a variance for our irrigation well that we've installed. There was a higher level of sodium in the water. The tests that we've run were at 53.7 and 61.04. And I know within your well requirements, number 2, you're looking at 20 milligrams per liter. Obviously, this is, like I said, is an irrigation well. It's not meant or to be used for potable water. We have a water service from the town that is servicing the development. So then that's really about it. I've gone through the regs trying to find if there was anything within the regs stating that well for irrigation had a limit on sodium. I have not been able to find anything on that, both in the state, federal, or local levels. I know that there is a recommendation by EPA and by Massachusetts to be at 20 milligrams per liter. And I know that the town of Scituate has it at 20 milligrams per liter for their testing results. So we're just seeking a variance for the for this basically because it's a well that is being used only for irrigation.
Okay. Karen, do you have any questions?
I don't.
Okay. And Joan, is there anything, or Drew?
No, it's irrigation. It's
Okay.
again, it's just so it's sodium. It's not something horrible. It's just
Right.
Yeah.
Okay.
Okay, well, I'll go ahead and make a motion then. I'll move
Okay.
to approve the requested variance from the water quality requirements of the town of Scituate private well regulation for sodium only. And the variance may be revoked or suspended in accordance with the regulation if conditions change.
Okay, second. And then we'll do a roll call of votes. Karen, how do you vote?
Yes.
And Doug White votes yes. And again, Kelly is not on with us tonight. So I think everything is all set. Drew, anything, or Joan that he needs to follow up with? I don't
He's
know.
all set.
Okay,
Okay, perfect.
thank
Thank you
you.
very much, Mark.
Have a great day.
Thank you too.
All right, second one, discuss and vote.
No.
Septic-
Go ahead.
Discuss and vote septic design hearing, 184 Central Ave, Riverhawk Environmental, representing homeowner request for installation of septic requiring local upgrades and variances. And do we have anyone from Riverhawk?
Yeah, for the record, my name's Bob Rigo. I'm with Riverhawk Environmental. We did the septic design for 184 Central Ave, and this particular site is located on Humrock Beach, essentially. So it's got I believe the South River on one side of Central Ave, and then the other side of the property is the Atlantic Ocean. So kind of tucked in between the riverfront area and then the ocean. What we tried to do was keep the septic so we wouldn't have to maintain the groundwater separation and keep it over tucked to the side. We actually are looking for a variance from 5 feet to 4 feet because we get a less than 2 minute per inch perk. And we're also looking at a reduction in the property line setback from 10 feet to 5.5 for the soil absorption system and 10 feet to 5 feet for the septic tank. And that will just allow us kind of keep it further away from the river, up above the groundwater table, and not require us to kind of fill in the whole driveway and not provide a place to park, I guess, for the future. That's about it.
Oh, Doug, you're on mute.
Thanks. So there's no driving over the septic and stuff?
There
I
is
mean,
not,
okay,
no, the septic is placed on the side of the house. Yes.
Okay. Karen, do you have any questions?
I don't think so.
Okay, Joan, or I don't know if
No,
Joan,
it's out in Hummerock. It's on, Central Ave, and
right,
it's an upgrade to the system, so we're happy with it.
okay. Then Karen, you want to do a motion?
Yep, I'll make a motion to approve the septic repair plan for the following updates requested for 184 Central Ave. The first is approve the request and with the reduction from the required 10 feet to 5.5 feet between the SAS and the property line. The second is to approve the reduction in the required 10 feet to 5 feet in the separation between the septic tank and the property line. And finally, the reduction in separation between the SAS and the high groundwater from 5 feet to 4 feet. It's also pending Conservation Commission approval and engineering satisfactory revisions to the plan to address the Board of Health Administrative Review comments.
Okay, I second. And to do a vote, Karen, how do you vote?
Yes.
Okay, and Doug White votes yes. And again, Kelly is not with us tonight. So I think everything else is set with that. And thank you, Bob.
Thank you very much. I appreciate your time. Thank you.
Yep. Okay, last item is discuss vote septic system design hearing, 4748 Townway Extension, Morse Engineering representing homeowner request for installation of septic system requiring local upgrades and variances. And I don't know if Mark's on.
No, nobody's gonna be here tonight,
Okay.
so I'm sorry, my camera and my microphone's not working on my computer, so. So Doug, you might remember, I don't know if Karen will, but this was brought last year for, they're putting a tight tank on 48 Townway Extension.
Yeah,
And Conservation had asked them to move it farther off the water and put it, they wanted it to go farther off and go in back on 47 Townway Extension to get it farther away from the water.
okay,
So the family has, so they had to do a easement with 47 Townway, obviously for the tight tank. And we also were waiting for DPW to give them a permit for the pipe to go under Townway Extension, because there was some confusion on whether it was a right of way or the town, it was a public way, but it is a public way. So they submitted their permit in June, but we were waiting for to figure out what was going on with Townway Extension, if it was a public way, a private way. So we finally found out it's a public way. And then it took a while for them to get their permit. So it went past the 45 days. So the state says if it goes past the 45 days, then they automatically have their variance. But I'm bringing it tonight to you just to let you know that there is an easement 47 for the tight tank. We're okay with the septic system. It's fine. It doesn't need any other variances. It meets all the other criteria. They will have to do a deed restriction on this that will be documented with the deed of Plymouth County Deed of Records. And so Conservation's happy with it being farther away from the water. So we're just bringing that to your attention on, it's really just an update. You don't have to vote on it, but you can vote on the easement because it does have a discussion vote tonight. So I guess you do have to vote one way or the other.
all right.
So
Karen,
it's you're voting for the easement.
okay.
Okay, well, I'll move to approve the septic repair plan with the following variance requested, and that is to allow the tight tank beyond the property line of 48 Townway Extension and 47 Townway Extension to grant the easement for that move.
Second, and how do you vote, Karen?
Yes.
And Doug White votes yes. And again, Kelly is not with us tonight. Okay. Moving on to new business.
There is no new business as of right now.
Okay, old business.
The only old business that we have, and it was not known prior to this being posted last week, is that we are going to have the recycling people that came in back in, I believe, April. Karen, I believe you just come on the board.
Yep, I remember them. Yep.
We have a new board member in Kelly. She's not heard anything about it. So I think it'd be a good idea if we bring them in. And then we can just go from there and see what happens. But they have been looking to come back in again. So I think now that we have a full board and, you know, we're looking to actually have it happen over in, hopefully we'll be ending our Zoom meetings soon and we do this in person over at Town Hall, but that's the only thing under old business that we have.
Okay, and we would probably look at maybe, because I know our next meeting's the 25th. If we're going to go back to Town Hall in November, starting in November, that would be the 8th that we would probably put it on. Okay.
Right.
All right. Director's report.
The director's report. So we have 17 sets of plans under 45-day review, 12 waiting engineer revisions, 4 awaiting Concom approval, and we have 24 systems in failure currently. We have our COVID-19 update. In the state right now, we have 144 people in the ICUs. 92 people have been intubated statewide as of, I got these numbers 10 o'clock this morning. So we've kind of leveled off with that. So that's a good thing, I guess. But, you know, with that, the state positivity rate is 1.92%. The town's positivity rate for the last 14 days is 1.62%. So we're below the state rate. 75% of Scituate residents are fully vaccinated. We're slowly creeping up. I think when we started actually getting the numbers, we started around like 68 or 69. And, you know, every month or so, we get up a little percentage point. So the big number that we're looking to try to get people to talk to their doctors about maybe getting vaccinated is that 20 to 29-year-old age group. So that is where we are with that. And we are not giving out booster shots this year, or this for the COVID-19. We did give out shots earlier. We gave it to first responders. We had a couple of clinics. Right now, we are not going to be doing booster shots. We recommend if you are going to be getting a booster shot, and right now the only one that is available that has been approved is the Pfizer booster shot. We recommend you call your physician, a CVS, a Walgreens, any pharmacy. They should have it. That's the best way to get it right now. And with that, not only is it time for booster shots, it's also our flu shot update. We are having a couple of clinics coming up. We have one on Thursday, October 21st at the Senior Center from 10 to 11, and then from 1 to 2. And then we have another one Tuesday evening, November 2nd, at the community building on Jericho Road, and that's going to be from 5 to 8 p.m. at night. To sign up, it's on the town webpage. If you just go on the Town of Scituate, go under government, and if you click on the Board of Health webpage, the link is right at the top of the page. You can also call your pharmacy to get your flu shots. A lot of physicians' offices give out flu shots right now. That's another great way to get your flu shot. It's the ideal time right now, October, November, December, to be getting your flu shot. You want to make sure you have protection, you know, through April and May. So it's a great time to get it. You don't want to get it too early, but anytime after October is a good time. And Karen's a nurse, and if I did anything wrong, make sure you correct me, okay?
No, you nailed it.
We still have Triple E and West Nile virus around. We haven't had any positive mosquito pools or cases in Scituate. It's gonna be around until we get a good frost. You can still mosquito proof your home and your yard, you repair screens. A lot of people are out on screened-in porches late at night, or they're out around a campfire late at night. Make sure if you have any standing water on your property, whether it's a wheelbarrow, anything that's standing, you want to make sure that you just tip it over, because that's where they're going to breed. So, and if you are going to be out at dusk and dawn when mosquitoes are most prevalent, you should wear mosquito repellent with DEET on it. So those are things you can remember: long sleeves, shorts, pants and shirts too. And I think that is all I have.
Okay. All right. Any questions, Karen, or anything?
I don't think so.
Okay.
I do have invoices that need to be approved.
Okay.
I have flu clinic related one for $34 and another flu clinic one for purchase of vaccine for $9,188.
Okay.
And I have another one for a perk, which was $280.
Okay. Do we need to make a motion on those or just approve?
A motion to approve the invoices.
Okay.
So
I make a motion. You want to do it, Karen?
I just said so moved. You can second.
Okay. And second, and Karen, how do you vote?
Yes.
And Doug White votes yes. And as we've been saying, Kelly is not at the meeting tonight. Okay. Other than that, make a motion to adjourn the meeting of the Scituate Board of Health for Wednesday, October 13th, 2021. Do I have a
Second.
second? And how do you vote, Karen?
Yes.
And Doug White votes yes. And again, Kelly is not on the call tonight. Other than that, I think we're all set. Everyone have a great week and be safe.
Thank you so much. Thank
Thanks,
you,
everybody.
everyone.
See ya.